Hi students, today we will learn about eye irrigation. Eye irrigation is a procedure which is mainly done to clean the eyes, remove any foreign particle and to provide comfort. Before the procedure, we have to identify the patient and explain the procedure to the patient and also assemble all the articles near bedside. A tray containing Macintosh with towel, irrigating solution or normal saline, syringe without needle, gallipot containing dry cotton swabs, a pair of gloves and a kidney tray. First, we will wash our hand and wear a clean glove. Then we will place the kidney basin and turn the patient's head towards the affected side. Then we will expose the lower conjunctival sac and exert pressure on the bony prominences, that is cheek and eyebrows. Then we will place the syringe 1 inch above the eye and start irrigating from inner cancus to the outer cancus until the eye is fully irrigated. Now take a dry cotton swab to wipe out the excess fluid. After the procedure, we have to replace all the articles, discard the waste and record any significant finding.